Today, I invite Mr. Fantahun Beyene to discuss his PhD research project on stigma reduction and awareness for maternal health promotion, enhancing mental health service utilization through reducing perinatal mental health stigma in Ethiopia. Welcome, Fanta, to sit down with me to discuss your PhD research. To start with, can you please introduce yourself to the students?
Thank you, Prof. Wendy, for inviting such important session. I am Fantahun Beyene from Ethiopia. I'm a midwife, and I have taught both undergraduate and MSc midwife and nursing students when I was in Ethiopia. And I am a researcher in the field of maternal health. Currently, I'm a PhD student in James Cook University, Australia. Yeah, that's.
Thank you so much for your self-introduction. Can you please give us a brief introduction to your PhD project? I can see how important it is. And so what motivates you to do this PhD project and what's the project is about?
Yeah, thank you. My work is focused on perinatal mental health, stigma reduction, and awareness for maternal health promotion in Ethiopia. So my motivation to do this is perinatal mental health is a global issue, as you know. And this issue is more problematic in developing countries, like in Ethiopia. And the main factor of this is due to low utilization of mental health. This is affected mainly by the stigma. So, finding what is the main barriers and gaps and addressing that or finding appropriate intervention is essential to minimize or to avoid these barriers. After minimizing this stigma, then we increase or enhance the mental health utilization, then the burden will minimize. So this one.
Thank you so much. What is a perinatal mental health condition and how stigma is related to this condition in Ethiopia?
Thank you. So perinatal mental health condition is a mood disorder that occurs during pregnancy, which call it antenatal mental health condition, or within the first after birth, which is postnatal mental health condition. When we talk about perinatal mental health condition, we commonly talk about perinatal depression followed by anxiety because of the commonality of the others is perinatal depression. As previously explained, perinatal mental condition is a global health concern with significant consequence of maternal well-being, children, family, and the at large the community and the health system. So in the world, around 1 in 4 perinatal women experience depression. When in low and middle income country, it becomes more problematic and devastating effects, which reaches around 24 to 26% of the perinatal depression in low middle income country, including Africa and Ethiopia. Why it is more problematic in low middle income countries and including in Ethiopia? Because of different stressor events are common in such developing countries. For example, poverty, gender norms, violence. It may be intimate partner violence or family violence and such things. And the other may be limited services, lack of trained health professionals. And the other is due to stigma. Due to stigma, there is low mental health utilization. If there is low mental health utilization, there is complicated perinatal mental health, like depressions. So due to this, it is more problematic. Yeah. In Ethiopia, perinatal mental health condition is closely linked with stigma because women often face shame, blame, and spiritual interpretations, gender role expectation, and fear of being judged. And that is due to misconceptions. Like depression is considered non-medical issue. And due to spiritual punishment, they consider depressant individuals are due to spiritual punishment, not a medicals. So individuals prefer to go the religious or other healers, traditional healers rather than the modern healers. So due to this, they discourage them from seek to early help and leads to underdiagnosis, undertreated, and it becomes more complicated. So it is a closely linked in Ethiopia because of cultural taboo, because of misconception. The stigma is commonest, and it linked to the perinatal mental health directly. Yeah.
Thank you so much, Fanta. I was hearing that you talk about perinatal depression and also stigma attached to this mental health, perinatal mental health condition. And for example, the misconceptualization of depression, such as it's not a medical issue, but the punishment
Yeah.
of towards the individual. And therefore, you develop a project focusing on stigma reduction and awareness for mental health promotion, maternal mental health promotion. And could you please tell us a little bit more about your research project? First, you already talked about stigma reduction is important. And what is the methodology you use to design the prevention so that we can help perinatal women reduce stigma related to mental health conditions and go for help, asking for help, and to deal with the issue?
Yeah. Thank you. As you explained, the focus of my project is on co-design of stigma reduction to promote maternal mental health service utilization. So before going to directly to the detail of the design, it's better to know somewhat what means stigma in general. What is stigma? So stigma is it is socially constructed mark of shame or disapproval that leads to rejection and discrimination, social exclusion because of some conditions. For instance, individuals are excluded because of mental health illnesses. That's mental health stigma. There are different forms of mental health stigmas are there, like social stigma and healthcare professional stigma, structural stigma, and self-stigma are there. So when you talk about social stigma, societies have a bad attitude towards individuals who have a mental health illness, then which leads to mental health problems worse and delay problems or delay a person from getting help, then it becomes the problem more worse. Yeah. Healthcare professional stigma means that the health professional having a negative attitude towards the individual's mental health illness, which creates discriminatory treatment, unequal giving care, lack of empathy, and such things. Then the individual becomes or lack of openly discuss with health professionals. So the problem becomes more complicated. And the other is healthcare structural stigma. This structural stigma probably it is induced due to policy, institutional procedures, and thus the illegal rules. And that practice or restrict opportunities cause systematic disregard or neglect their rights at early. Self-stigma arises when individuals internalize societal or stereotypes, which lower self-esteem and reduce motivation. So these are very essential. So because of this condition, stigma is a major barrier. It's a major barrier to mental health revitalization. Yeah. Therefore, stigma reduction is essential. Because of stigma prevents someone from recognizing symptoms and disclosing distress and seeking timely care during pregnancy and after birth are delayed. Because of fear of judgment, blaming, and labeling. In developing countries like Ethiopia, mental health problems are labeled in different ways, like due to Buddha, AIDS, and several labeling are there. So to avoid this, to prevent this, we will develop co-design stamp intervention. What it means or how we develop it. So the intervention is being designed using co-designed methodology, guided by the principles of interventional mapping approach. So, which brings together women with lived experience or end users, partner, key community stakeholders, health professionals, and health cabinets, clinical psychologists, mental health professionals are collaboratively develops the program. These approaches ensure that the intervention is culturally relevant, acceptable, grounded, and real community needs. So it strengthens ownershipness and it improves the feasibility and increases the likelihood of that the intervention will be used and will be sustained. It has sustainability because of it is formulated by the end users also. So this one is the main characteristics of our. This approach will address two key questions, like what are the drivers of perinatal mental health stigma across the individual level, interpersonal, community, organizational, and policy levels. So we speculate the factors in each themes. After we identify these factors, so what intervention it will be developed? What intervention component will be co-developed with the experts and the end users, like those having previous experiences. So those two questions will be addressed properly in the co-design workshops. So in that intervention, mainly there is awareness rising, challenge misconception might be in the interventions, and build supportive behavior. And so by using maybe psychoeducation on prenatal mental health condition or storytelling, lived experience, narratives, and maybe strengths or guide health workers, healthcare professionals to be non-judgmental, culturally safe care by providing training and some workshops. So such activity will be performed. Yeah.
Thank you so much, Fanta. You mentioned the co-design methodology, and you will work with the communities, including people with lived experiences, and also, for example, women with pregnancy, and
Yeah.
also 12 months, within 12 months after giving birth to their babies, and also their family members, service providers, community leaders, and different level of uh, communities. And also, for example, you would like to understand what is stigma from a cultural lens. And for example, what does it mean by social stigma, professional stigma for perinatal women in Ethiopia? And also, you will employ the framework of intervention mapping to have different stage of the design, the co-design process. Very well done. And I understand that the content of the intervention will be co-designed. I am curious, do you have some ideas what would be included in your intervention? For example, what kind of themes would be included in your intervention and from your literature review or from your experience working with perinatal women in Ethiopia?
Mm. So what intervention component we include? The intervention component we include is in the, like it's probably we maybe include like psychoeducation is one, and we may be training for health professionals, and psychoeducation for perinatal women, and maybe to education for both the perinatal women and the health professionals, maybe incorporate.
So you will include psychoeducation for perinatal women as well as professionals,
Yeah,
and so that professionals would understand, mental health professionals, yeah, understands the stigma related to maternal mental health.
yeah.
Very well done. And my last question is, as an expert in mental health stigma reduction and raising awareness of maternal mental health, what is your general messages to individuals with lived experience, for example, maternal women and community researchers, funders, and policymakers?
Okay, thank you. So my message is for individual, es- especially for mothers or perinatal women, partners and families that play a crucial role in recognizing and responding to perinatal mental health needs. Therefore, they considering pregnancy and their transition to parenthood are not a sign of weakness. So some of uh, taboo behaviors or misconceptions are like becoming pregnancy, becoming a mother is like taking us as weakness. It is not a weakness. Rather, it is a gift. Rather, it is a blessing, a deeply and meaningful stage of life. So you should understand this one. At the same time, this period brings major physical, emotional, and social changes. So you should know this the physiological change, and now the abnormal change. So things deviate from the normal. So you should openly discuss with your health professionals rather than the other communities. Do not give attention to what the people say. So come early if anything occurred and openly discuss with your health professionals. So, and be aware that perinatal mental health conditions are is a common and treatable. So after we are aware about it, after having detailed awareness about it, then if anything that happen that mimics perinatal health depression, so come to early or health professionals rather to the traditional healers. Listen without judgment. Avoid blaming language. And encourage open conversations. So the family should encourage the mother openly discuss. And support early help settings is very essential as individual level. As a community level, communities play a key role in shaping the belief, the norm, expectation that influence perinatal mental health. So, communities should challenge harmful cultural beliefs, such as labeling that distress are weakness, and spiritual due to spiritual fear, due to povertyness. No, should be avoid such things. So this thing is minimizing by the communities. How to avoid this? By discussing with the peer group, the local leaders, and by forming dialogue with them. And promote accurate informations rather than these misconceptions. And create safe space or environments to the perinatal women. So by doing this, we can minimize perinatal stigma. And message to the researchers, researchers have responsibility to generate evidences that is meaningful, culturally grounded, and actionable evidences. So the researcher should prioritize action researches like co-design researches that involves the end users to the development of the program to ensure its sustainability and address stigma as a structural barrier, not just as individual barrier only. It is a structural barrier. It is a multifactorial and produce evidence that supports the prevention, early intervention, and system level change. Not only clinical treatment is prevent stigma or avoid stigma. So by considering this, a researcher should give emphasis on perinatal mental health. Message to the funders. So funders must redirect their focus towards mental health. Because of mental health conditions and stigma, it's a global issue. So should they focus to that? So where investment can generate profound and last population levels, it has an impact. And invest community-based culturally relevant interventions, support long-term funding, because stigma reduction requires continuity. not in one times. Priority equity. So funders should shift or focus toward this as a general to mental health and support for long-term funding. And by doing this, and we can find evidence-based strategies to prevent stigma. Message to policymakers. So policymakers shape the system that determine whether women receive timely, respectful, and cultural self-care. And in general, policymakers should have a clear policy toward this perinatal mental health stigma and perinatal mental health, how to address it. So the first one is should have as a policy integrate perinatal mental health into routine maternal health care. You should be including screening, referral pathway, and workforce trainings. It should be integrated and address social determinants. Recognize stigma as a public health concern and have a policy. Should have a policy, a clear policy. So by considering this, so we can minimize the mental health stigma. Otherwise, by conducting a single approach, we can't totally avoid it because of it is a multifactorial issue. So this one.
Thank you so much, Fanta. Provide the advices for individuals, mental health professionals, and policy as well. So for uh, individuals and for maternal women, I think the most important message you sent out is it's okay to seek help.
Yeah.
And for professionals, you encourage mental health professionals to use encouraging language to encourage maternal women to seek help. And for community, and you would like to see that community to provide support for prenatal women with mental conditions.
Yeah.
And for researchers, which is very important, that you believe co-design research is important and also provide evidence-based research for reducing stigmas and raise awareness of maternal mental health conditions. And you also mentioned for funders, it's important because all the interventions and also research need fundings. So you encourage or you recommend the funders to invest community early intervention and also develop evidence-based research in this field. And for policymakers, your advice was to develop policies to raise awareness of maternal mental health. And thank you so much for all the advices. I really hope your PhD research would contribute to this field and also to help maternal or perinatal women in Ethiopia to cope with maternal mental health conditions and also supporting their families as well. And well, Fanta, thank you so much for your very insightful talk. I really enjoyed the discussion and all the best for your PhD research.
Thank you. Thank you, Prof. Wendy.
Thank you.